I chose WWAMI for a lot of reasons. I knew that I would be able to be close to family, but also get, a world-class medical education.
If you look at the debt you're going to accumulate, for me, it was a third or a fourth of what I would have accumulated going to different programs.
This program is kind of like a family. It's a class of 20.
I love Wyoming. I love living here. I love the community. And so being able to give back to a state that has given me so much is something that I really value.
WWAMI is a collective medical school arrangement between the University of Washington and WWAMI states who don't have their own medical school.
WWAMI stands for Washington,
Wyoming, Alaska,
Montana,
and in Idaho. The state of Wyoming is picking up a large portion of the tab for our students. And the requirement is that the students, when they enroll in the WWAMI program, they have to sign a contract that says that they will come back and practice medicine for at least 3 years once they finish their residency training. Wyoming WWAMI students, when they first come into the program, we want to make sure that they understand the legacy that they are a part of. It was 70 years ago when the state legislature had the vision of how important it was to train great physicians for our state. Many of the leaders in Wyoming medicine have been supported through programs like the WWAMI program. It may not have all been at the University of Washington School of Medicine, but it was all through the state vision of supporting medical education in the state of Wyoming. You are now part of something much bigger than yourself. When students go do their rotations, people in those communities take notice. The state of Wyoming is going to count on you to provide excellent care to their families and extended families. As a WWAMI physician, you're going to make a profound impact on the sustainability of our great state. Our legislators and our governor will be consulting you as they formulate policies and laws that shape health care. Over half of our WWAMI graduates obtain faculty appointments at the University of Washington School of Medicine in an effort to give back to our current WWAMI students by teaching into our program. People are counting on you. They're going to be counting on you to be a leader. We call the first 2 years of medical school your foundations curriculum. Taking a patient history and doing a physical exam and learning your science content. And then what we do is we have what's called a transitions to your clinical years, so the patient care phase of your curriculum. So we have foundations in the first 2 years, and then we have the patient care phase of the curriculum, which is your third year, and what that is are required clinical rotations in some core subjects of medicine. So for instance, you'll have a rotation in internal medicine, and you'll have a rotation in general surgery, etc. in that third year. And then the fourth year of your curriculum is called Explore and Focus, and those are elective clerkships, because at that point you're trying to decide what do you want to specialize in so that you can match into a residency program that meets that particular specialty. When students are enrolled at the University of Washington School of Medicine and they're, let's say, a Wyoming resident, they'll do their training at their own home site for the first 2 years, but when they get their degree at the end of 4 years of medical school, it'll be an MD degree from the University of Washington School of Medicine. For about 25 years now, the University of Washington School of Medicine is in the top 3 of all medical schools in the country when it comes to primary and rural care, and that's what we have. The entire state of Wyoming is designated as rural. It's a great fit for the state of Wyoming. The curriculum is identical. They take the same exams here as they do in Seattle or any other regional site. All of the content is exactly the same, delivered on the same day, the same hour, you name it, it's the same content. When you think about the medical school curriculum in the first 2 years, it's helpful to break that down into 3 main components. There is what we call the didactic classroom experience. And so that is where you're learning your science content and you're doing it in an active learning format. There's also a component that is their lab experience, where they go to our human cadaver lab and they're involved with dissections of human cadavers to learn their anatomy content. And the third component is probably the most fun for the students, and that's where they learn about their clinical skills, where they learn how to interview patients, how to do physical exams, and that's something that we call the foundations of clinical medicine.
If you think about a regular undergraduate or graduate college schedule, you've got 3 or 4 classes at once and they're spread out over the course of a whole semester. With a block, what you have is one class at any given point in time, but you spend a lot of time in it during the week. So during Invaders and Defenders, my block, I see the students on Monday, Tuesday, Thursday, and Friday for 4 hours a day. And so rather than having all of that content spread out over the whole semester while juggling it with other content, think of it as deep immersion. You get a lot of it for a shorter period of time, but that's the only language that you're speaking during that point in time in the classroom. But then we're gonna bring in experts who are very, very good at that individual session, and we'll have them teach. The best case scenario, in my opinion, when there's me as the block lead that understands what's come in the block, what's coming in the block, I have a basic science subject matter expert, and then I had a clinician.
The fact that WWAMI really incorporates all types of professions into teaching you gives us multiple aspects of each thing that we're studying and really allows us to have a full circle picture of whatever we might be exploring at that time. So I think it's great to be able to learn from doctors, and the doctors that they bring in from all across Wyoming and the WWAMI region are phenomenal.
We'll say all the time here that medicine's a team sport, right? No one doctor's just on an island. They've always got resources and they've got colleagues to go to and resources that they can utilize, and we see that in the classroom during their training. While the students are with me doing Invaders and Defenders, we're talking about microbiology and immunology, but all of that's affected by these other topics that were thought of as threads that should, rather than being blocks, if you think of those kind of like linear silos, threads are what should run through and you should see for the duration of the curriculum, right? So the particular threads that our students see are human form and function, think of that as anatomy, histology and pathology, so at a cellular level, how everything looks when things are right or when things go wrong, and then pharmacology, because no matter what block you're in, those are areas that are going to affect or add nuance or add depth to what you need to understand, and as a doctor, how you're going to need to interact with patients.
Human anatomy is found in every aspect of the clinical experience, and it's not something that you can gain from a textbook because a textbook is drawn into the very perfect ideal world where everybody is the same, and this is not actually what we find. And so in the anatomy lab, students get a sense of how the human body can vary. I teach 2 out of the 3 threads for the UW-SOM curriculum. They are called HFF, or Human Form and Function, and Histopathology. And so that means that I teach the gross anatomy and the micro anatomy. I set up the foundation for that histological content that is used in the pathology portion of the medical curriculum so that students know what normal is versus pathological.
Our anatomy lab is state of the art. It's one of the best anatomy labs in the country. It's only 3 years old now. Our anatomist, Allison Doherty, she looked at several medical schools across the country, looked at their lab configurations, and designed that whole lab, and we were able to construct it from the very beginning all the way through. It's a terrific lab.
Human form and function includes the study of the human from the embryological state all the way through the end of life. And so we look at how the organs are programmed in our embryological sessions, and then we take that, apply that knowledge in the anatomy lab and how that forms the adult form. And we look at that in association with radiographic imaging, and we focus on a variety of modalities in that realm of imaging where a future clinician will be primarily using those images to inform their diagnosis in many cases. Students will come in, they will learn from all of the donors, and likewise the students will help to inform their partner students.
Historically, and even at some other programs, medical students won't see their first patient until their third year. We're very fortunate here in that in the first month that we were in medical school, we were doing physical exams and history on live patients in the hospital.
So this program really emphasizes patient first and clinical experiences. So even from the beginning, we're being able to apply our didactic skills to the patient in a clinical setting.
It's a great part of our curriculum where they're starting to talk to doctors about how to be a doctor while they're working with us on basic science and with me on the organisms that they might see and how our body responds to them. So I think we see a nice synergism so that we don't lose context of why the students are here, what they want to do.
My job is to oversee the aspects of the Foundations of Clinical Medicine curriculum. Right away, when the students first come to medical school in the fall, we do a 2 to 3 week immersion process where we actually, in a brief period of time, teach them how to do a complete history and physical examination of a patient, including obtaining the patient's story, as well as teaching them physical exam techniques that they're going to be using later on. The second part is actually 3 concurrent parts that run throughout the next year and a half of medical school, and that includes hospital morning visitations. Students are able to go over to Ivinson Hospital and meet with one of the hospitalists in groups of 5, and they're actually able then to practice their interviewing and physical exam skills on those hospitalized patients. Concurrently, along with that, we have clinical skills workshops. Those can vary anywhere from ethics to professionalism to more advanced physical exam skills, and oftentimes we'll do a simulated patient scenario in a medical office where the patients are actors who play sick patients, and the students are then able to practice again their physical exam and interview skills.
The patient simulations are awesome. They're so fun. It's a wonderful and uncomfortable way to dive into medicine and into that future role. It really helps with the interpersonal skills and asking the uncomfortable questions, but then also problem solving and seeing a person as a whole and trying to break down what they tell you to really figure out what the problem is that they are currently experiencing and how to attack that problem. And getting to do it as a team and with our mentors is so great because it's just a growing experience, and every time you do a simulation you get a little bit better. I think that real-time constructive criticism is so important. You might have a little hiccup, but those mentors are there to pick you up and to say, okay, how do we learn from this? And what can we do next time to make sure that that doesn't happen? And 90% of the time you never forget that thing again because it really sticks in your brain that way. But then also having the support, being ready to catch you, kind of takes the pressure off of making a mistake.
Students are also matched up with what we call PCP, or primary care providers in the community, not only here in Laramie but also in Cheyenne. And this is where the students, rather than working in their groups of 5, are actually able to work one-on-one with a physician every other week in the clinic. And these are providers that work in the trenches and the front lines primary care. And so the students then are able to develop more of a focused approach to a patient.
We also have a lot of clinical opportunities where, for instance, if you're interested in surgery, we have physicians at Premier Bone and Joint that are more than happy to have our students come up and scrub in for surgery, elbow to elbow with them as they're in surgery. We have a baby beeper program where our OB-GYN physicians that are up at Ivinson Hospital, when there's a baby about to be delivered, our students are in a list and you'll get that beeper, and when that goes off, you need to come up to the hospital so that you can observe that baby being delivered.
I love getting to go meet doctors and work with them because they just care about me liking med school. I think that's something that's pretty unique to this program and really, really valuable. I have been first assist on a surgery. I've watched multiple deliveries and C-sections and helped out with things. I've done sutures and removed warts from feet.
I really feel like WWAMI allows them to practice those clinical skills sooner than later, so that by the time they're out on their clerkships, where they really need to be learning about medicine and caring for patients, they're not bogged down in the nitty-gritty details of how do I get the patient's story, how do I perform a physical exam, am I exuding professionalism, am I communicating well with the rest of the team and with my attendings. So I like to think we take care of a lot of that before they go off to clerkships and start their patient care phase.
Feels good leaving the foundations phase knowing that I can do some of those hands-on skills and that I'm not all brain right now. I can also use my hands.
Step one is the USMLE board exam, and this first step is testing the students over all of their foundational training. So it's all the basic sciences, basic anatomy, physiology, pathology, all of the major organ systems, pharmacology, biochem, microbiology, and all of that kind of pulled together. So that's their basic sciences prior to them entering the patient care phase, which is when they're doing clerkships and starting to work with patients in their clinical rotations.
Wyoming students consistently score among the very top of any students at the University of Washington School of Medicine on their Step 1 exams.
As the person who helps prepare our students for Step 1, which is the first part of our board exams, I work with students from their very first year all the way through their second year prior to taking that board exam. I work on helping them kind of build a more consolidated picture of diseases and how they're treated for that exam. So instead of just rote memorization for exams, we actually work on assimilating all of the different blocks of information that they're learning, and so that they can answer these very difficult questions that we call them third order questions because they tend to be complex. It's never asking you what's the name of something, it's always in relation to a patient or in context with a patient. First year, I have them working on long-term retention of material. We work on study techniques like spaced repetition and retrieval practices. So a day or a week after they've learned something new, they practice retrieving that information. And this kind of helps build patterns of long-term memory so that as they're taking complex exams, they're able to better retain and assimilate all of the knowledge that they've gained during those first 2 years. As they enter their second year, then we start working on taking sample board questions. So I set calendars with them, we have schedules for study, and then of course as they get into what we call the dedicated study period, which is an 8 or 9 week period after their term 3 ends, we work closely together for a daily study plan tailored to each student so that they can take Step 1 with the best preparation possible.
Historically, University of Washington has a great pass rate. You know, it's up in the 90s, it's really high. So I don't think students will ever have to worry about being able to pass. If they passed all of their blocks through foundations phase and are doing what they need to be doing to prepare, I think they will be set up for success.
My goal is to help our students get into any type of residency that they would like. So the STEP is actually a very important part of getting into, or what we call the match to get into specialty programs.
If you look at the University of Washington School of Medicine's kind of track record for matching into residencies, competitive residencies, I mean, it's just top notch.
Over time and in the next few years, Step 1 is becoming pass-fail rather than a scored exam. So I think that future classes will have a different experience with STEP. It might not be quite as stressful for them.
We have greater number of faculty per student than what you're going to have at a bigger site. So when we have 20 first-year students and 20 second-year students, other people have referred to it as a boutique site, where you're just getting that individual attention here that you're not going to get at a bigger place.
Wyoming has a unique aspect in that students can really have that one-on-one time with their instructors and with their clinical preceptors and with their FCM mentors.
To me, that's everything. It's what helped me be successful in undergrad at the small university I went to, and it was something that I knew I needed when I came to medical school as well. I think that colloquialism, while maintaining like a professional environment, is just such an amazing way to learn, because you really get to make those personal relationships with your colleagues, the students that you're learning with, but also with those mentors whom are teaching you. And I think that being able to go to them and being unafraid to ask questions and to be vulnerable and to make mistakes is just such a beautiful way to learn. And I think that it's an easy way to learn because you know that you have that support and that close-knit relationship with those around you.
We are a small program. We like to call ourselves the WAMILY, W-W-A-M-I-L-Y, family, WAMILY family.
You're never left behind. Everyone's always taking care of one another.
And I really like it and feel that. And you know, it's interesting because I feel it personally both at the 6 region-wide level, right? When I'm on our invaders and defenders calls with the block leads from the other 5 sites and, you know, folks that are in there teaching, like, I can tell that we are all in this together.
I didn't realize coming into it how many people would be so invested in my education. That was such a pleasant surprise to just really feel like the state and the faculty here for the WWAMI program really want you to succeed. That's just always been so reassuring the whole time I've been in school.
The fact that they are willing to reimburse your loans if you do come back and work here for your first 3 years is huge. And it's such a wonderful way to go through medical school with a lot less fears financially.
The WWAMI program really uniquely prepares us to come back and practice in Wyoming because from day one, we are networking with physicians all across the state. And that just continues to grow throughout our education. So by meeting doctors in various specialties who come down and teach you or might be involved in your WWAMI education in some other way, or you might do a clinical rotation with them at some point during your 3rd and 4th year, you're really meeting people from all across the state that can play a big role in you getting a job here someday. And also, you know, it opens up a line of communication for you to be able to ask them questions about practicing in Wyoming and get to know what their lives are like and see what is the best fit for you.
But we're fortunate enough in our small Wyoming cohort that we're able to kind of, what I like to call, put more of a Wyoming spin on it, or maybe something that's a little bit more specific to rural Western medicine.
The WWAMI Wyoming cohort is the only program in the country that gets certified as wilderness first responders, which is pretty dang cool. There's things that wilderness first responders can do that first responders within city limits cannot do. For example, clearing a spine in a situation that's outside of a certain radius of a hospital. We're able to do that.
Some of our students in the summer between their 1st and 2nd year will do a RUOP program where they go for 6 weeks and are on site in a rural area in Wyoming working with and shadowing a physician there. Everything that happens in a community has the possibility of walking in that door. And so our students who have taken that opportunity always come back and have this really solid understanding of what it was like to practice and be a doctor, and their clinical correlations just significantly jump because they're there just seeing kind of all of it all day, every day for this 6 weeks that they're there.
In the WWAMI program, you have physicians that have experience with these rural communities, but they also have the experience of what's available at some of these big medical centers because they're required to train in Seattle. You have the largest trauma center in the Pacific Northwest in Harborview that's in Seattle. Our students are going to train there. They know what's available in these big city locations, in these big medical centers, and they also understand the limitations associated with rural communities. So when you have a WWAMI physician, not only do they understand the lay of the land in these rural communities, but they understand what resources exist in these large medical centers, and they can easily make the decision when does a patient need to be transferred from their current resources to something that's more specialized that can only be offered at a big medical center.
You know, we see quite a breadth of talent, interest, quite a breadth of previous clinical experience. And so I'm here to tell you that anybody that wants to be a physician has no excuse not to become a part of our WWAMI.
My favorite part is that I'm not the only non-traditional student. We all bring a really unique perspective to the program.
After my first year, I spent my summer doing research at Seattle Children's Hospital with a pediatric orthopedic spine surgeon. And so I got to be there for 10 weeks. And I just had the most amazing experience there, and I just loved the work we were doing, and it really opened my eyes to orthopedics, which I didn't know if I would ever be very interested in that. So WWAMI gave me that opportunity to go ahead and go somewhere and do research.
If you want a wonderful education from one of the best medical schools in the country, but you want it in your home state with a wonderful staff and a small, close-knit group of colleagues, Wyoming WWAMI is the place for you.
I wouldn't discount the emotional aspect when you're making these decisions, going to school at the Wyoming WWAMI program is different than just going to medical school. You're the pride of the entire state. Every physician here is pulling for you. They're doing what they can to help you succeed. And just not to mention like everyone that lives here. I mean, the state is investing a lot into us, but we're investing a lot into the state.
I'm coming back to Wyoming. I've always wanted to, and so this program is really just best suited for me.
Again, as somebody who grew up in Wyoming, has always lived in Wyoming, it's reassuring to know that these are the folks that are going to be taking care of me in my old age.